honour to be invited to give this talk. So, as has been said, I'm going to take you on a journey of where we have got to in England and Great Britain on this journey towards certification. And I wouldn't say that we're there yet. I mean, it is a journey. We're on our way, but we're not there. And I'll tell you where we've got to and how we've got there. And just to highlight, I thought I would just highlight that you can see in the letters after my name, I've got FF RPS. So that's going to be relevant later, but that is a faculty fellow of the Royal Pharmaceutical Society. And this group, the Royal Pharmaceutical Society, have set up this faculty with the aim of introducing accreditation to that. So I thought I would just highlight that, and we'll come back to that later. So to start off with, I'm going to use terms like accreditation or credentialing or certification. I'm going to use those interchangeably. But why would we want to do this? I think there's a number of reasons. I mean, firstly, for our patients who come first, it's good for them to receive a consistent level of pharmaceutical competency around the country. And so that will give them some assurance that they're going to get a similar level of pharmaceutical knowledge and skills wherever they go to. So there's benefits for them. Also for the managers. So if a manager is recruiting to a post like a critical care pharmacist, it's going to give them some assurance that they indeed are getting someone who is competent for their role. So that's a benefit. And also for us as practitioners, it's good for our career development. It's good for us to progress and get training, and also to have a career structure that we can develop without necessarily having to go into management. Some of us don't want to go into management, or we might manage a small team, and that's fine. But we want to develop our knowledge of our speciality and get recognition through that, and this gives us a path through that. So that's good. And then also professional recognition. So it's nice to have letters after your name in recognition, of studies that you've done and professional recognition through your governing body. And of course, it also supports revalidation as well, to show that one is keeping up to date in one's profession. So I think there's a number of reasons why credentialing is important for all stakeholders really of healthcare. And so the way that in England, the way we've sort of moved forward, I think we had to put a couple of things in place before we could really develop credentialing for the individual practitioner. And the first thing was really to be clear in our minds what good looks like. What makes a good pharmacist? What is a competent pharmacist? We know that there's knowledge. They need to know their subject matter in their speciality and a certain amount of general knowledge as well. But it's not just about knowledge. You need to be able to apply knowledge. It's not just about knowing stuff. You need to have a load of other skills. And so I think we went through a process of really trying to understand and establish and agree, what does make a good pharmacist? And that was really important before you can start accrediting practitioners against that sort of standard. So where we got to is we created these domains, so-called domains, and we're sort of defining here what does good look like. And so obviously knowledge and skills are really important, and that's one part, but also being a leader and being able to manage. So to be an educator, to also have a research ability, knowledge and understanding, also having good professional practice and professional standards, and an ability to communicate. So these so-called domains were defined, and then within each of these domains there was a whole lot of subcategories, and I'm not going to go through them all, but they all are available online if anyone wants to go through and really see what underpins all this. But just to give you an example of one just very small section of quite a big document. So one is on is this one, and just to sort of guide you through this, at the top we've sort of defined different levels of practitioner. So advanced stage 1, advanced stage 2, and mastery, and this is one of the domains of professional autonomy, and it defines what would be expected of these different practitioners at different stages of their development. So, for example, in this case, at stage 1, the practitioner would be following, if we say trust, that's another word for hospital. So hospital guidance related to their critical care unit. This is specific to critical care. Advanced stage 2, they'd be developing some of those guidelines for the critical care unit, and not just following, but developing. And then at mastery level, that practitioner might be writing the guidelines, not just for one's own unit and hospital, but maybe for a region or a network, or even nationally, or perhaps even internationally. So the sort of scope of practice increases as the practitioner stage and level increases. And so this is defined against all these different competencies. So I talked about sort of these different domains. There's also knowledge. And so within critical care, but indeed we started it in critical care, and it's all been done in all the other specialities as well. We went on to define, what is the knowledge required for a critical care pharmacist. And here I've got a small section within cardiovascular, and we've gone through a few different stages of this, or versions of this, and the new one is about to come out, I believe, in a few weeks. So that's quite exciting. But I think this was the second version that came out, and within each category, we've got within critical care, there's a lot of general knowledge, but there's also some specialist knowledge. And so we're sort of generalists because we know a bit about a lot of things, but then we've also got critical care specialist knowledge. And indeed, in terms of the generalist knowledge, there's going to be other specialities who are going to share this knowledge as well. It's not just critical care. So a cardiology pharmacist or a general pharmacist will know quite a lot about the cardiovascular system as well. But a critical care pharmacist will have some specialist knowledge that other pharmacists won't have. And so that's all been defined in a sort of matrix. And we've also tried to define the different levels of knowledge of more advanced practitioners. So an advanced 1 practitioner will know a certain amount, but a level 2 will know even more, and a mastery level pharmacist will know much more as well. So we sort of tried to define, what would be expected at these different levels in these different domains. And once we've got these defined, then it's a bit easier to accredit, and practitioners can then work out where they are on this sort of matrix. So I'll sort of give you the critical care experience, because actually within the UK, the critical care group had quite a major role in developing where we've got to generally in England and Great Britain. And so I can sort of talk you through that. So it started off with the knowledge. So we were asked by the Royal Pharmaceutical Society to try and write down what is the knowledge within our specialty. And so we did that in our first version of that in 2008. And I've just showed you a little glimpse of the more updated one, 2014, and there'll be a new one out very soon. So it's sort of part of a journey. And then subsequently, our critical care group of the UK CPA in 2010 were commissioned by the Royal Pharmaceutical Society to come up with a credentialing process and to pilot it. And we were asked to think of a process that would work for critical care, but also work for all the other clinical specialities, and indeed could be applied across the board to pharmacy in general throughout the country, including community pharmacy. So we wanted to have quite a general process, but would work for critical care. And what we came up with was this, in a sense, a 4-stage process. We recommended that the practitioner should have a portfolio of practice, which they would put into a, well, it would be a portfolio. It would be mapped against this competency framework that I've mentioned, and against all those different domains. And they would state where the practitioner thought they were with regard to evidence. So within management, they would say, well, I'm a mastery level manager because I manage so-and-so people. Within research, I'm a lead investigator in so many studies, and therefore I'm at the top of my game here. But actually within leadership, I'm not doing so well. I'm more of a mastery stage 1 for leadership, for example. And so they would actually map in this sort of matrix with evidence in their portfolio. But what we were sort of concerned about was we didn't want it just to be a portfolio, just a paper exercise. We wanted to see that people could actually practice in the real environment. We didn't want them to be just good on paper. And so we threw them into some live scenarios. So we investigated a KEX. So a KEX would be a live clinical situation, actually in our case, in the critical care unit. They had to see a new patient with they hadn't seen before, but a typical sort of patient, and they had to evaluate and review the patient, the drug chart, the notes, and also have interactions with the medical staff, the nursing staff, without any preparation. So what were they like actually, in a real life situation? And then also a case-based discussion, a CBD. So here they had a clinical scenario given to them, and they had 30 minutes to prepare. And then they would be asked questions and to see the extent of their knowledge. And it's something literally they had only 30 minutes to prepare for. And then also we did a 360-degree contact with their multidisciplinary peers, doctors, nurses, fellow pharmacists within critical care, outside critical care. So with that, putting all that together, we'll try and map that against this competency framework and give them a conclusion of, well, we think you're at might be mastery or stage 2 or stage 1, and this is what you did really well on the day. This is where we think you've got areas to improve. This is how we think you can do it, and a positive sort of feedback, and that was their credentialing process. And we went on to pilot it, and I was actually one of the first group who was a candidate in that. So it was a very stressful day and very robust, but it was very good. I think it worked very well. We adapted the process a little bit. We learned from our experience, and we published a couple of papers in the Pharmaceutical Journal at the time about the process of how we came up with this process. And we also did a feedback paper where we asked all the candidates and all the examiners as well what their experiences were, and we published a paper on that just to give the profession some understanding of where we're going with this, because again, it wasn't just for critical care. The idea was that this would be a process for the whole country of pharmacists, practitioners. And there was a bit of a dilemma though, because we wanted an efficient system. We wanted it to be simple and affordable. We wanted it to be fair. We wanted to be able to assess what the practitioner knows, but also can they apply the knowledge in practice. And I think our process was mainly successful. I think it was a good process, but there were some problems, and the problems were really that it was inefficient because we needed lots of assessors. We needed 4 assessors, I'd say 6 practitioners. And I think eventually we did 4 assessors for 8 practitioners. But really, we've got so many pharmacists and so many pharmacists in the country that is not really a scalable process. And I think that was the problem with what we came up with for. I think it measured what we were trying to measure well, but in practice it required too many assessors, and it just wasn't scalable. I think that was the critique of it. So the Royal Pharmaceutical Society have sort of moved on with this, and they want the process. They've developed this process now, and their starting point is they've sort of defined the practitioners at different levels. So newly qualified colleagues, advanced, and also consultant level pharmacists, which would be the equivalent to mastery level. And we talk about they present in this way that we've got newly qualified staff, starting off in their early years as practitioners. We've got core advanced practitioners, and by that we mean these are advanced level pharmacists, but they're not specialized. So they're sort of generalist pharmacists, but they're non-specialized ones. And then we've also got the advanced specialized pharmacists. And then we've got a few number of consultant pharmacists who are at that mastery level. And so they decided to set up this faculty, that is the Royal Pharmaceutical Society, and to have these different categories of credentialing. So recognizing these different stages of membership, and also staging a progression through these different stages. So this advanced stage 1, so you get these sort of a banding of advanced stage 1, advanced stage 2, and then as I highlighted at the beginning, this FFRPS, that's the faculty fellow. So as I'd been through that process and that first iteration of our process, I was awarded faculty fellowship, and that was a great honor. And so I still use that after as my sort of credentialing sort of description. So there was a whole sort of series of people who got these sort of credentials after their name, who went through this process. But it was, as I say, a very rigorous process. And so again, they're sort of defining different levels of practice here. So what's the difference between an advanced clinical practitioner pharmacist and a consultant level pharmacist? So in the red maroon, it's the advanced level. In the sort of green, it's the consultant level. And there is some overlap, certainly in the middle, in the black area here. They both are going to have a high level of experience and expertise, and be patient-centered, and have a lot of responsibility and leadership, education, research. They're going to work autonomously, and they're going to be able to initiate, monitor, formulate treatment plans, dependent on their area of practice. But there is differences in terms of consultant level practice. And if we just go across these different descriptors, so start at the bottom. So like a consultant level pharmacist would be responsible for education beyond their organization, and perhaps beyond their professional boundaries as well. Whereas an advanced level practice would be responsible for their own development and contributes to others. But a consultant just has that broader scope. So in terms of research, the advanced level practitioner will be engaged in research and service evaluation, but the consultant level practitioner will be identifying and leading research and evaluation. And so it goes on. I won't go through all of this, but you get the idea. So they've come up with a new process now, a slimmed down process, one they think they can scale up. Because I mean, in Great Britain, I think we've got 65,000 pharmacists. So it has to be something that is going to be able to work at scale. And so they have slimmed down that process. And now their new process is a portfolio, just a portfolio assessment. And that credentialing decision is made by more advanced pharmacists of a committee, and they recognise formalised learning that the practitioner has been on, and they will base their recommendation on previous levels of performance against the outcomes and the descriptors and the program of learning in terms, and comparing that to the curriculum. And they've developed what I showed you before. So they've got all these different, the domains are the same, but they've got now capabilities and outcomes and descriptors, and they've asked the practitioners to map their own levels of practice and experiences against this sort of matrix, and they can self-map that, and then that will be assessed by the committee, who will decide what level of practice they deem them to be at. And they encourage practitioners to have an educational supervisor, a practice supervisor, a mentor. They don't necessarily have to have all of these people, but a mixture of those sort of support structure to maximize their learning experiences, and say they'll record all this in an e-portfolio. So where are we in the UK with this? So we've got our knowledge defined, we've got a general core of knowledge, and we've got speciality specific knowledge defined. So, I mean, I showed you the critical care bits of knowledge, but they've done this in many of the other specialities as well, and also defined the core. And we've got defined levels of practice. We've got, we know what good looks like. We've defined that in those domains of pharmacy practice. We've now got a process and a professional body in place with credibility to give that accreditation. I think, but there is a but, and it's a big but very few have actually been through this process yet. It hasn't really taken off at scale, and it's about to be relaunched with this process. So I can't tell you that we've got this completely sorted and this is flourishing in Great Britain. But I think the sort of the structure is in place, and I think what we need now is probably the ideal situation is when employers insist that applicants for new jobs have been through this process, and that will be the tipping point, because if people know that's the only way to get a job, then you have to go through this credentialing process. That will be the point at which they will say, well, I've got to do this. And some people, the very keen people, will go through on their own back, but other people will follow this process when they really have to, and that's. But it's difficult for the employers, because they can't insist that people have to go through this process at present, because not enough people have gone through it, really. So they wouldn't have any applicants for their jobs. That's sort of where we are. But how do we get the clinical knowledge and the skills? So if I take you back to critical care now, so I don't know if it's the same in Nigeria, but certainly, when I was starting in critical care, myself and many of my colleagues were self-taught. And that has its problems. You obviously, if you're working in one institution, you sort of follow the norms of that institution, but that may not be the best way of doing things. And if you haven't got that sort of generalized approach that people sign up to, then you might be missing out, and that may not be consistent at all across the country. So it could be quite variable. So, they're really, up until recently, there was no broad training course for critical care pharmacists or critical care pharmacy technicians. So we developed a course. It's running into its 4th year now. So the way it started was back in 2019, pre-COVID. We started a course just in our local hospital for pharmacists and technicians, and for those in our local hospital around. So we were surprised we had 50 participants. it was more than we expected. It was a room full of people, and we couldn't fit 50 people in one room, so we did it twice and had parallel sessions every month. And then COVID struck, and that really devastated the healthcare environment in the UK. And critical cares were completely overwhelmed, and bed numbers more than doubled, actually, more like quadrupled. And suddenly, everyone was crying out for critical care trained staff, including pharmacists, and there was a real lack of staff. So as soon as we got over the first wave of COVID, we restarted the course because we had to suspend it. And of course, as we talked about today in the introductions, the e-learning platform suddenly proliferated, and what was impossible, what was only possible in a classroom, suddenly we did it online, and we could teach so many more people, and that was quite revolutionary. So we opened it up for our second course. We invited the rest of the UK, and we invited Commonwealth colleagues through the Commonwealth Pharmacy Association. We had many of your compatriots in Nigeria. We had 75 participants. We had 10, including 10 technicians. And that was really to try out the virtual environment. It worked very well. So this year we're coming towards the end of our third year now. And we've got, I think, around 175 participants this year from UK, Europe, Africa, New Zealand, Scandinavia. It's quite extraordinary. And it's a real pleasure to have a sort of community of critical care pharmacists and technicians who are taking part. And right now we're recruiting for 2024, and we've had over 1,000 applications to join the course. We're not going to be able to take everyone, but it's amazing what the demand is for education within critical care. It's quite extraordinary. So that's what we're doing. It's a real pleasure to be a part of something that's linking so many colleagues around the world, and it's quite extraordinary how this course has grown. So we aim to upskill pharmacists who are new to critical care. It might be people who are not normally critical care pharmacists, but maybe get dragged into critical care at weekends, or maybe in a COVID search or on call. Might be other specialists, but who might be cancer pharmacists, but a lot of their patients might come to critical care and they want to know more about what's happening to their patients whilst they're on critical care or as they leave. And also pharmacy technicians. Our pharmacy technician role is quite developed, and we have pharmacy technicians, and we want them to understand more about what they're doing and how their job relates to the patients within crit care. So we think that's really useful as well. We start with a baseline test, which we're not expecting people to know much about critical care at this stage, but it's a useful baseline. And then each month we have a different theme. We record a lecture. We give some reading material. We might put a YouTube video up as well to support different types of learners. And then we have a live session where we put the theory into practice, and we generally have case studies, and we try and apply the principles into real sort of situations. And we may include other colleagues, members of the MDT, dietitians, physios, doctors, nurses as well. And then we ask those who want to go on our competence route. We have two routes. We have just an attendance, where you just come to the lectures, come to the live session, or we have a competence route where we ask them to also do some tasks and see a number of patients every month, and to do some case-based discussions with their clinical supervisor, etc. This is our faculty. I've got myself, my colleagues from pharmacists who work with me in critical care. We've also got a neuro pharmacist and our pharmacy technician as well. So we've got a great mix of people. We've had very good feedback. In fact, I know we've had some of the people on this course have been through our course. So hopefully they would echo that it's a good course and well run. I think what's interesting also is we've also got a research centre in my hospital pharmacy department, and they've adopted the same approach we've taken. They've basically taken our methods, and they've started to run a research course for pharmacists as well, using pretty much the same methodology, the same sort of monthly lectures and the interactive and recorded materials. So that's quite nice, and I'm involved in this as well. So coming to the end now, this is the last slide. So I think certification, is important. It's worth doing. I think it has benefits for the patient. I think it's going to improve standards and consistency. It's good for us practitioners as well, to show how we're developing our knowledge and our skills over time. It's good for the pharmacy profession, and of course our medical colleagues have this. I think nursing colleagues will have this as well. It's good assurance for the manager that the staff are working competent, working at a high level, and it's good for equity of healthcare. So we get similar standards across the country. There's various models of doing this. So I've presented one. This is the Royal Pharmaceutical Society's method. Of course, there are other methods that may be better. They may have the advantages or disadvantages. I'm not familiar with them. I mean, I know some specialties will have their own accreditation, which, in some ways may be better. I've also talked about some of the education that supports this, because I think that's important as well. It's one thing having a process, but it's also the second thing really to have that education that supports that certification. And also I've shown you as an example our course, which is we call it the Fundamentals in Critical Care Pharmacy course. And so that's aiming to get pharmacists up to a basic, competent level that they can work independently. They're not at that finishing our course. They're not going to be an expert, but they're going to be competent and working to a certain standard. And that's a good place to start. I think the thing that's missing, from our practice, is we do need an advanced course, and I know we've been asked for that, and I think that will come in time. So yeah, that's sort of where we are in England. I'm not saying that we are exactly where we need to be, but we're sort of on the journey, and we're probably midway to where we need to be along that journey. So thank you very much for your attention. Very happy. And if anyone's got any comments or any questions.
Yeah, Dr. Schulman, we had over 100 participants. I underestimated the numbers. That's to tell you that there are a lot of people out here really wanting the knowledge and the expertise, and I thank you so much that you didn't go below our expectation. Oh. It was such a robust and lucid presentation filled with a lot of information, and that we can use in our various areas of practice. So, but before we go to the comments, question and answers, I would like to bring in my chairperson to give the remark. Dr. Maureen Nwafo, you have the floor to remark, and then we can go further. That's the next thing we have there on the agenda, your remark.
Okay. Good evening, distinguished colleagues. Hope I'm audible.
Quite audible, ma'am.
Good evening.
Good evening. Wow. I just want to thank God for today, that tonight we are showcasing critical care pharmacy to Nigerian populace. I'm so glad. I'm so glad. I want to start by thanking our dear national chairman, Dr. Joseph Madu, for the opportunity given to us in critical care pharmacy to showcase critical care pharmacy and how other specialties should be developed in our country, bearing in mind what is happening in England. On behalf of critical care pharmacists of Nigeria, we want to appreciate everybody that participated in tonight's presentation. We have over 100 participants, and as I'm looking at it, we've opened the is it online platform elsewhere now for others to join it, because we've reached our limits and people are still want to log in. So there's a link now for other people to join. So I want to appreciate everybody, especially our dear presenter, Dr. Rob Shulman, for agreeing to showcase tonight, agreeing to come with us to present tonight's presentation. We are very, very grateful. Thank you so much. Want to appreciate our moderator too, our dear critical care pharmacist, Mrs. Mwese Babalora, for a work done. I want to also appreciate my second desk officer, Dr. Timi. Wow, she's wonderful. In the planning, she was there with me to make sure that tonight's clinical meeting was a success. Thank you so much, Dr. Timi. I want to thank all the members of Critical Care Pharmacists of Nigeria. We've been trying to come up, and tonight we've seen it all. There is need for us to come together. Because from what I learned tonight, they start from somewhere, and the journey is still on. So we have to start from somewhere, and we'll continue to develop ourselves despite the challenges. So I want to thank everybody. There is need for us to go up. Pharmacy practice has moved on from the jack of all trades, no way again. You must have to narrow our practice down, and not only that, specialize and really satisfied. Very, very important. I tell you, I participated in this training he mentioned. That was last 2 years. After that training, my practice changed. I improved in my care, in caring for patients in the ICU. I encourage our participants to join in this forthcoming training on critical care. You will never regret it. Please enroll now. And I pray that from tonight's presentation, this will help all of us, despite your own specialization. I know it will motivate us to really get certification in our various specialties. It must not be critical care. Move on to where you have your passion and get satisfied. Your practice will be different. From what he said, we have so many benefits. It will improve our patient care, our standard of practice, even the pharmacy profession. Assurance for a manager. You can't be a manager if you don't know what you're doing. You know, it will help us to improve our responsibilities in the hospital, in the community, even in the academia. That's your specialty. You will be excellent in your practice. So I just want to thank everybody for joining us tonight, as we are going to start to listen to questions, comments, and how to improve our various specialties. Thank you once again. I'm so grateful.
Thank you, my chairperson. So the next on our agenda is going to be comments and questions. Dr. Morin, thank you for that wonderful appreciation. Dr. Shulman has been quite wonderful. He has really improved our practice and our different. I have also taken the course in the fundamentals of critical care, and it has actually improved my practice in my facility. You know, and all that. So for now, we would get to the time of questions and comments. If there are comments and if there are questions, please, you can unmute and ask your questions. I've been going through the chat room, but I haven't seen any question there, except for the person that asked whether there's a recorded session. Yes, there is. So I think that's the only question I saw. And maybe other people would want to ask their question. If you have any question, you can unmute now and ask your question. Do we have anyone with a question?
Somebody is raising hand.
The person only said
Yeah, I think Ola's got a question. He's got the hand up.
Okay, yes, I've seen a hand. Oh, pharmacist Ola Onunka, please, you can unmute and ask your question.
Okay. Thank you very much. I would like to say a very good evening to all of us, and to thank Dr. Rob for this night's presentation. I was also a participant in the 2021-2022 uh, certification course. And in fact, my practice is I'm able to participate as a pharmacist based on what I learned in critical care pharmacy. Now, I want to um, concerning the need for advanced courses for specialists. I think that's an area that we also need to look at because it doesn't just end with us having the competence certification. We also need to keep on improving. So we will need to have those advanced courses. That's one. Then two, it would be good for us to have some resources made available to us. Links that we can use to keep brushing up our knowledge on critical care pharmacy. So if Dr. Rob has some, it would be good to share with us so that we can keep improving on what we're doing. Then last of all, I think it would be good for us to create it would be good to have a database of pharmacies that have gone through this competence course, so that we can kind of like have whether a WhatsApp group or whatever, where we can share our knowledge and share ideas internationally, not just here in Nigeria. That's like a suggestion that I have. Thank you.
Yeah, Dr. Shulma, would you want to respond?
Yeah, thank you, Ola. Thank you very much for your kind comments about our course, and I'm really delighted to hear that. I think you make some good points. So in terms of we need an advanced course, that's definitely the case. I mean, we've started our course, and I know that there's other courses that are going to be produced, and I've been in touch with the ESICM, European Society of Intensive Care, and they are very recently really trying to develop their pharmacy component of this organization to make it more multidisciplinary. And I've got colleagues who are on the committee there, and I know that they're going to be developing a more advanced course. And I think within the UK as well, National Health Service England, they had a meeting 2 weeks ago, and they're about to release what the outcome of it is, but I'm expecting that they are going to be commissioning a course for like what we do, so the fundamental, but then the next level, the more advanced course, and also courses for technicians. And so they'll be inviting providers to bid for that work. So I think the next level courses are on the way. They're going to take a little bit of time to prepare. I mean, the ESICM course, I think, is going to be really good for pharmacists, and they're really making it cheap to encourage pharmacists to enter, because they want to build up that group. And so, I mean, at the moment, it's like £55 to join the ESICM, which is is about it's a cheap price compared to medical colleagues, and I think for that you get a free use of all their courses, and there's a huge educational component in there. And I say there will be a pharmacist course as well in time. It's not there yet. So yeah, we need more courses, and all the other specialities need to develop their courses as well. I think the whole opening up of e-learning, makes this possible, and it can now be done at scale. So that's a great technological breakthrough that we can really take advantage of. I think you're right about having a central record of people who've gone through this, and something a bit more official. And that's why you need an official body to sort of sanction and quality assure the education providers and say, yeah, this is a high quality course, and if you've gone through this course and done all the activities and you've got this certificate, then you can this means something. And ideally, if you've got a national body, then you can put some letters after people's name and give them that real sort of sense of achievement that would be recognized by their colleagues. So maybe that's something to think about within your organizations, if there's that infrastructure to provide that.
Okay. Thank you. I think there's another question here for you, Dr. Schulman. There are a number of questions, but I think I will take the ones that are specific to you, so you can just answer at once before I go to the other ones. Is there a link? Someone is asking Dr. Schulman, is there a link to access certification courses?
Course. So, so our course, we've got a web link. We've got two ways for our course. We've got two ways of entering the course. The first is a paid method. So you can enter the course directly through that method. We've got a second method, which is which we offer to colleagues from low and low middle income countries, and we're going to give a number of free places to this source. But we have had it. We are very much oversubscribed. That's the issue with that method. I'm happy to share the link to both those methods of joining our course. But I can tell you that we've got, in the free places one, or supported places, we've had over 900 people apply for next year's course from all around mainly around the Commonwealth, many African countries, but other countries as well. So it's obviously, I say, a huge demand for this sort of content.
Okay. All right. So the next question is to Dr. Wafo. Someone said, can you kindly share details of the certification you did? That's Dr. Murray. You mentioned you attended 2 years back.
Okay, the lead pharmacist is Dr. Sherman over there, so he can throw more light on that course.
Shall I take that one? So with certification, so I say we have got two methods. We can say you attended is one. You listen to all the lectures, you take part in the live sessions, which we record as well. If you can't make can't expect everyone to make every session, but they're all recorded and they're all accessible. But then if you go on to, you have an educational supervisor, and if you go back to do all the tasks, so say if we do a renal month, then you go and speak to your nurses and the doctors on the unit, and you find out how your local hemofiltration machine works or your hemodialysis machine works, and you do a case study with your educational supervisor looking at drug dosing in renal failure. And so you do the task for whatever it is for that month, and you get that signed off. And you also see 5 to 10 patients per month, and you present those to your educational supervisor, and you continue to do that every month for the whole year and do all the other tasks. Then you sign that off, send that to us with your educational supervisor's signature, and then we provide a certificate and say, yes, you've got competence in critical care, you've come to all the educational material, you've taken part, and you've done all these tasks. And your educational supervisor, who knows what you're like locally, because obviously we don't know you. It's sort of beyond the scope of what we can do to really know what's going on the ground. So your educational supervisor takes on that role, and they sign you off and say, yeah, done a great job, you've completed all the elements of this course, and then we give a certificate saying, yes, you've completed it all.
Okay.
Okay.
Thank you for that. The other question is, can a non-practicing pharmacist in the UK join the course?
A non-practicing pharmacist
in the UK.
In the UK, I mean, if in the UK, it's a paid-for course. So if a non-practicing pharmacist pays their subscription, then they can join the course. I mean, they're going to struggle, I guess, to do all the tasks. If they're not practicing in a critical care unit, then I guess they're not going to be able to do the competence. They certainly can do the attendance, come to the lectures, take part in the live sessions.
Okay.
Can I throw more light
Yeah, you can. You can, ma'am. Yeah.
Okay, thank you so much for the opportunity given to me to talk again. I want to state that we have something here in Nigeria that we can benefit of if you want to specialize in critical care pharmacy. Our West African College of Pharmacy, Faculty of Clinical Pharmacy here in Nigeria is offering critical care pharmacy as one of the subspecialties. So feel free to get your forms, enroll in our college, and specialize in critical care pharmacy. It will open your eyes so much in this subspecialty. Then you can still go ahead to look for more certification and training. We have our local training here. So feel free to join the college and enroll in critical care pharmacy subspecialty. It's a way for us to move ahead. I can start from any local training, any hospital that you know that have a critical care pharmacist in the IC, you can stay there and see what they're doing. Then you can continue to have passion, move into the college while you seek for foreign certification too. Thank you.
Thank you so much, my chairperson. Okay, so someone has said we need materials to keep developing ourselves. I think that's just about all that we have in the comments and question section. I guess there's no hand raising to ask a question. The rest are just appreciation for you, Dr. Schulman. Wonderful presentation. It was insightful, it was concise and straight to the point. It was an excellent presentation. It was, what can I see again? It was lucid and it was insightful too. So is there any more? Is there room for collaboration between groups like SIPAN and your faculty? Is that question meant for Dr. Schulman or for Maureen? Dr. Maureen, I don't know.
It's for Shulman now. It's for him.
I mean, I can't
Okay,
speak.
Okay, yes, it's for you, sir. Is there room for collaboration between groups like our Clinical Pharmacists Association of Nigeria and your faculty?
I mean, I can't speak for the faculty. I mean, I'm a member, but I mean, I'm not, you know, on the board or anything like that. But I dare say they'll be open to collaboration, and I think they would benefit from. I think both sides would benefit from each other's experience. You know, obviously they've got some experience of going of one way, but I'm sure they'd be open to your experiences as well. So, you know, I think it'd be worth reaching out to them. I'm sure they'd be interested. I wonder also with the FIP. I don't know if your colleges and organisations are engaged with FIP at all. So I think they've got quite a lot of background in sort of education and credentialization. And I know some of the people, you know, at the top of FIP were sort of quite involved in the establishment of this credentialing process early on, when they were previously with the Royal Pharmaceutical Society. So I don't know. I mean, do you have much involvement with FIP? Federation of International Pharmacists?
Is that a question?
Because that might be a good collaboration as well, because we getting the best of a credentialization from around the world. Because I think it is quite well established in Canada and the US, and certainly in the UK we're lagging behind. I think those groups, I think the Australians as well, are quite advanced as far as I know. So, you know, there might be quite a good collaboration with those sort of groups.
Okay, all right. Okay, so our chairman, that's a clinical pharmacist of Nigeria, Dr. Joseph Madu, said we're working to register with FIP. So to the person that asked that question, there's an ongoing process to see that we register with FIP. Then somebody has asked that, can you recommend a site or platform that we can download materials or have more information about pharmacists' role in critical care?
I mean, our organization, I mean, the equivalent organization in the UK is the UK CPA, that's the UK Clinical Pharmacists Association Critical Care Group. That's the national body for critical care in the UK. But it doesn't really have, I mean, it's the information there is for its members, so it's not really outwardly facing so much. The other group is the Intensive Care Society of England, and that has a burgeoning pharmacist group. And then, as I said, the European Society of Intensive Care is getting more interested in pharmacist involvement, and there's a lot of educational information on their website, and they often have educational webinars which are free to non-members as well. But actually, and the membership, I say, for pharmacists is much lower than it is for other professionals. So they're really trying to encourage international members and particularly pharmacists, trying to build up that section. So, I mean, I would say if you had one site, I mean, the ESICM is quite extraordinary. I mean, the amount of information they've got there for critical care is quite astounding. So, but it is, I say, it's about £50 to join, UK pounds. But after that, there is a huge amount of information there.
Okay. All right. Thank you. Dr. Maureen, there's a question for you. Someone is asking that as a fallout of the question as a fallout of your comments, that's Dr. Maureen, where you talked about the college having a specialty in critical care, that will a fellow that finished long time ago before the time subspecialties come back for critical care specialty that you talked about?
Okay, thank you so much. The college is on top of it. We've been having pressure from our colleagues that they really want to specialize, because when they did their fellowship, there was nothing like subspecialties then. So the college is on top of it. They're planning to bring out a top-up program for old fellows, if I may use that word, for top-up, so that they can now specialize in their area of interest. So very soon, the program will come up. Thank you.
Okay. Yeah, I think that's just about that.
Okay, can I, sorry, can I make, please,
okay.
Please, we are up to 100 here. Please, I want to encourage non-members of CPAN to register and join CPAN. Once you register and join CPAN, just 5,000 for full members and 4,000 for associate members, you can now join our different subspecialties, which critical care pharmacy is one of them. Please join CPAN and chat us up so that we can add you to Critical Care Pharmacists of Nigeria platform, where you can learn more on how to work as a critical care pharmacist. Join CPAN, that's the way to go. Thank you very much.
Okay. Then the other question is, how can the community pharmacists specialize?
I think that the Royal Pharmaceutical Society have very much got in mind community pharmacists in their process. And they're very aware that the majority of pharmacists in England and GB are community pharmacists. So I think their process is very much, inclusive and is good for community pharmacists in the same way as it is for hospital pharmacists and specialist pharmacists. And so I think it's about, for a community pharmacist, it's about having the broad general knowledge in their scope of practice and and meeting the sort of standards that are set within community pharmacy, and having that portfolio that maps to that. So I think that's one of the advantages of the process that I described, is that it can be applied, to a community pharmacist, to a academic pharmacist, to an industrial pharmacist, to a hospital pharmacist. It's whatever scope you work in. It's a very generic sort of process that we know there's a knowledge, there's a certain number of skills, but there's a lot of commonality, and themes within all of those are the same. It's leadership, it's management, it's knowledge, it's professionalism, it's research. And so whichever area you work in, that's still going to apply. And I think that's why they've chosen that process. Whereas, like an Australian or an American approach will be more specialty specific, be the critical care, and that's very specific to critical care, and each other specialty will have their own sort of domains and processes. But I think that in GB, that's why they've gone for such a general process, so that it's very inclusive for everyone, wherever they worked.
All right. Thank you so much for that response. Any more questions? Dr. Schumann, I want to say that this time spent with you was well spent. It was a wonderful time, and it was a well-spent time. Thank you so much. In the absence of any question or comments, I think the next on our agenda will be the closing remark, and this will be done by Dr. Timipre Agogo. Dr. Timipre Agogo for our closing remark. Oh, sorry, there's a question. Let's just ask it. Sorry, Dr. Agogo. With regard to CPAN registration, please explain who is an associate and a full member. Is there a link to make the registration?
Our chairman, can you talk to us, please? Dr. Joseph Fuman.
All right.
Sorry, sir, we can't hear you, sir. It's muffled.
Can you hear me now?
No, sir, it's still muffled. There's a lot of noise.
I can.
You can.
I don't think Dr. Joseph's network is bad. Can you hear me?
Yes, we can hear you.
Okay, this is Dr. Shajawa Emeru, the National Finance Officer for CPAN. National Finance Officer too for CPAN. It seems like my chairman's network is disturbing him. So for full membership, as regards your question, for full membership, it's for those that are pharmacies that have masters in clinical pharmacy, MPharm clinical pharmacy, PhD in clinical pharmacy, West African postgraduate fellowship in clinical pharmacy, or they have any board certification or any other certification, postgraduate certification in clinical pharmacy. Those are full members, then including PharmD too. PharmD holders too also belong to the full members group. While the associate members are pharmacists that probably have other certifications that are not in clinical pharmacy, or just a Bachelor of Pharmacy alone. So that's just the difference between the two of them.
Okay. Thank you so much, ma'am. Yeah.
Affiliate members are final year pharmacy students who are graduating soon and want to join CPAN. So those are affiliate members. Then once they become full-fledged pharmacists, they can either become full members or associate members, as the case may be.
Okay. All right. Thank you so much. Okay, so the next is to have a closing remark by Dr. Timipre Agogo.
Yeah, good evening, everyone. I want to thank you so much. We thank our wonderful presenter, Dr. Rob Showman. Sir, we really appreciate you. Thank you so much for accepting to do this presentation for us. And then we want to say this is just the beginning. We would like to have more of this with you also in future. I also want to thank the SIPA National Chairman, Dr. Joseph Madu, and also every executive present here. I can see the National Secretary is here, Dr. Olulawa Motihatma. You are highly welcome. We thank you so much. And our Vice Chairman, who also doubles as our desk officer in critical care, Dr. Maureen Nwafo. Ma, we thank you so much. I want to thank you also, our wonderful moderator, Dr. Babalola. We thank you so much for standing in for us. We want to use this opportunity to also remind us that critical care holds our monthly meeting every last Thursday of the month. What we had today is a special edition from SIPA National presentation, which featured critical care. So we are expecting to have another presentation, although we are going to be closing for the year. We are going to be closing for the year. Presentation in November is supposed to be the last presentation for the year, and our next presentation is supposed to be coming in February, because our break will run through December, January. So just like our desk officer one, Dr. Maureen Nwafo has appealed to us, please let's join SIPAN. And if you are interested in joining critical care WhatsApp group, please contact us so that we can add it to the group. And then I know Dr. Joseph Madu wanted to find out if community pharmacists can be part of critical care, even though some persons have been asking. From what we have learned today, critical care is strictly, a hospital setting, and then not just the hospital setting. You have to be in the intensive care unit. So I want to thank you so much. Thank you everybody for coming. The wonderful more than 100 participants that we had both here and also in the YouTube link. We are going to be sharing it. We are going, because this what we did today has been recorded. We are going to be sharing it so that those that want to go through it can also go through the recordings. So thank you so much.
Okay, thank you, my special secretary. Thank you so much for that closing remark. So to join SIPAN, contact 080-333-76-881. Yeah, 080-333-67-881. For the last time, 080-333-67-881. Please, can Dr. Timothy, we're still calling you back for the closing prayer. Thank you.
All right. Can we pray in Jesus' name?
Amen.
Father Lord, we want to thank you so much for making it possible for us to gather here this evening. We've had a wonderful time this evening. We had a wonderful lecture. Father, please want to please help us. Everything that we have learned today, we want to actually apply them. Want it to be useful to us. Some of us are on our way to go and sleep. Father, please beg you to please protect us and also guide us. Some in other countries may be going about their normal business. To beg you to please help them see through everything they want to do tonight or in the morning, depending on where they are. We ask you for all these things in Jesus' name. Amen.
Amen. Amen.
Thank you,
Thank
Dr.
you so much.
Thank you, everyone. Enjoy your
Thank you.
night
Good night.
sleep.
Yeah, good night, everyone. Thank you so much for
And
joining.
thank you for the wonderful
Thank
moderation,
you.
Dr. Moise.
Thank you,
Good
Moise.
night.
Thank you.
Good night, ma'am. Good night, everyone. Was
Yeah.
nice having all of you. Thank you.
Well done, yeah. Nice.
Oh, somebody is still waiting for the link. Don't worry, you will find the link.